Did you know there are 5 health checkups you should probably avoid after age 70? Tests that could harm you more than they help. It's a hidden truth that most seniors will never hear from their doctors. Every year, millions of us line up for these checkups, believing we're doing the right thing to stay safe. But what if I told you that some of those routine tests, the very ones your doctor insists you need, could actually be pushing you closer to unnecessary surgery, a stroke, or even cancer? New studies reveal a startling fact. Up to 37% of medical tests performed on seniors lead to treatments you don't need, complications that can be serious, or side effects that last a lifetime. And the most shocking part? Nearly every senior over 70 is completely unaware of this hidden risk. One of these checkups, the number one on our list today, is now believed to cause up to 5% of all cancer cases in the United States. That's the same number of cases caused by drinking alcohol every single day. You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried in the science, and today, we're uncovering it all. In this video, we'll reveal the 5 health checkups you should question after 70, and the frightening truth about what they can do to your body. Everything is backed by real science, and you won't believe what made it to number 2. Let's start with our first test. It looks harmless, but it could quietly ruin your quality of life. Number 5, the bone density scan. It sounds simple and safe. A quick scan, no pain, no needles, and you walk out knowing if your bones are at risk for fractures. But here's what no one tells you. After the age of 70, a bone density scan often creates more fear than it does benefit. This test, officially called a DEXA scan, measures how strong your bones are and is mainly used to look for osteoporosis. But in older adults, especially women, the results almost always show lower bone density, even when there's no real danger. That's because some bone loss is a natural part of aging. Just like wrinkles or gray hair, it happens to everyone. And yet, many seniors are pushed into taking powerful medications like bisphosphonates. These drugs are meant to strengthen bones, but they come with a list of serious side effects, including jaw necrosis, a rare and painful condition where the jawbone actually starts to die, and severe irritation of the esophagus. Here's the real problem. Studies have shown that for people over 70, treating mild bone loss with these medications has very little impact on preventing actual fractures. A study published in the Journal of the American Geriatrics Society followed over 1,200 women over 70 and found that these drugs reduced the risk of a fracture by only 0.3% after 5 years. That's a tiny benefit. Instead, those women were far more likely to suffer from the medication side effects, including digestive problems, inflammation, and even oddly brittle bones that break in unusual ways. Consider the story of a woman we'll call Eleanor, a 76-year-old retired librarian. She was referred for a DEXA scan after her yearly checkup. She'd never had a fall, had no pain, and enjoyed her daily walks. Her scan came back showing osteopenia, which is just a mild reduction in bone density, not full-blown osteoporosis. Her doctor immediately put her on a powerful bone-strengthening drug. 3 months later, she developed terrible acid reflux and a deep, aching pain in her jaw. When she finally sought a second opinion, she hadn't enjoyed a meal in weeks. She was taken off the medication and started on a simple regimen of vitamin D, weight-bearing exercises using resistance bands, and a diet rich in calcium from foods like sardines and leafy greens. A year later, she was back to volunteering at the library with stronger legs, better balance, and 0 fractures. A short scan might seem like a smart move, but for people over 70 who aren't falling or breaking bones, the better option is lifestyle. Strength training, balance exercises, and proper nutrition have been proven to reduce fractures by over 20%, according to a 2022 study. Don't let a number on a screen scare you into a treatment you may not need. But there's another scan that can lead to something even scarier: brain surgery. Let's talk about that next. Number 4. A brain MRI for memory loss. When seniors start to feel more forgetful or confused, the natural reaction is fear. Fear of dementia, fear of Alzheimer's. So, doctors often respond by ordering a brain MRI. But here is the uncomfortable truth. An MRI, which is a detailed scan that shows the structure of the brain, rarely provides the clear answers patients are hoping for. In fact, most MRIs in people over 70 simply show age-related changes, like slight shrinkage or small white matter spots that are perfectly normal in older adults. But here's the catch. Once those harmless spots are seen on a scan, they can trigger a cascade of fear, more tests, and even unnecessary surgery. Surgery that may not improve memory and can actually make things worse. In 2021, a study in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaints. An incredible 86% showed some form of brain abnormality, but only 3% of those findings were linked to an actual treatable condition. That means 97% of those people went through the emotional turmoil of hearing there's something wrong, when in reality there wasn't. Worse, nearly 12% were sent for invasive procedures like spinal taps or even exploratory biopsies, all based on vague results from a scan. Think about Arthur, a 74-year-old retired accountant who came in worried about his memory. He was still sharp, but he was misplacing his keys more often, and occasionally forgetting a name. His doctor sent him for an MRI, which showed some of these common white matter changes. Arthur panicked, absolutely convinced he had early dementia. He stopped driving his car and stopped going to his weekly card game. Over the next few months, his anxiety spiraled. But when he was reassessed using a standard cognitive test, his score was well within the normal range for his age. It was explained to him that those MRI findings were age-appropriate. He was helped to focus on simple lifestyle interventions, like improving his sleep, staying hydrated, and doing crossword puzzles. Within 3 months, his memory had stabilized, and more importantly, he felt like himself again. The truth is, unless there are severe neurological symptoms like seizures, a sudden personality change, or a rapid decline in function, an MRI is rarely helpful for mild memory loss. A much better first step is a simple cognitive screening test. It's just a paper-based exam that evaluates memory, attention, and problem-solving skills. It's inexpensive, effective, and it avoids the risk of unnecessary panic. Now, brace yourself, because the next test on this list is one you've probably had multiple times, and it's number 3 for a very good reason. Number 3, the cardiac stress test. This is one of the most common tests given to seniors who complain of mild fatigue, chest tightness, or just not feeling like they used to. A cardiac stress test is a procedure that monitors your heart while you walk on a treadmill, or while you're given medication that makes your heart work harder. It's supposed to spot blocked arteries. But after 70, this test often does more harm than good, especially when it's used on people who don't have clear signs of heart disease. That's because it can lead to false alarms and unnecessary heart procedures that carry very serious risks. The problem lies in its accuracy. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%. That means the test says there's a problem when there isn't one. This often leads to follow-up procedures like angiograms, and even unnecessary stent placements or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stents placed after a stress test referral were done in patients who had no real symptoms and received no real benefit. Those patients saw no improvement in their survival or their quality of life after the procedure. What they did get, however, were higher rates of bleeding kidney injury from the contrast dyes used, and long, difficult hospital stays. This is what happened to a man we'll call Walter, a 75-year-old retired handyman who stayed active by working in his garden every day. During a checkup, he mentioned that he sometimes felt a little tired walking up steep hills. His doctor scheduled a stress test just to be safe. The results were unclear, so he was sent for a cardiac catheterization, a procedure that inserts a tube into the arteries to look for blockages. A mild narrowing was found, and a stent was placed. But that night, Walter had a bad reaction to the contrast dye and developed acute kidney problems. He ended up spending 6 days in the hospital and needed follow-up care for weeks. And the fatigue he felt on hills? It never changed, because it was never a heart problem to begin with. He was simply an older man who needed to drink more water and rest a bit more after his big projects. If you're over 70 and not experiencing classic heart symptoms like chest pain during activity, shortness of breath on exertion, or a major drop in energy, then a stress test might do more harm than good. A better option is often a resting EKG, which simply looks at your heart's rhythm while you're still. Or even a coronary calcium scan, which is a low-radiation imaging test that shows if dangerous plaque is actually building up. These are safer, simpler, and far less likely to push you into a procedure you never needed in the first place. Number 2, the colonoscopy. You probably didn't expect to see this one on the list. But a colonoscopy, the procedure that uses a long camera to examine your colon, is not always a wise choice after age 70, and it's almost never recommended after 75, unless you have specific, concerning symptoms. The risks simply start to outweigh the benefits as you age. The preparation is harsh, involving powerful laxatives that can cause severe dehydration, dizziness, or even kidney issues in seniors. The sedation used during the procedure poses added risks to brain function in older adults. And perhaps most surprisingly, the test itself can cause serious complications like bleeding, a tear in the colon wall, or even heart rhythm problems during sedation. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved from colon cancer. But over 20 people experienced serious complications from the procedure itself. That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, many are small and so slow-growing that removing them in an older adult can sometimes do more harm than leaving them alone. Consider Margaret, a 73-year-old grandmother who volunteered at her local community center. She had no symptoms, no bleeding, no changes in her bowel habits, and no family history of colon cancer. But her new primary doctor, fresh out of his residency program, urged her to get a screening colonoscopy. She agreed. During the procedure, a small polyp was removed, and she was sent home. But that night, she experienced intense abdominal pain and fainted. At the hospital, doctors found she had a bowel perforation, a tear caused by the procedure. She spent 9 days in recovery, lost 10 pounds, and has never quite felt the same since. When her case was reviewed, it turned out she had already had 2 clean colonoscopies in the past. There was absolutely no medical reason to repeat it. The U.S. Preventive Services Task Force now recommends stopping routine colon cancer screening at age 75 for most people. For those who are in excellent health, a stool-based test, like the FIT test, which is a non-invasive fecal test you do at home, is often a much safer option. It has no preparation, no sedation, and it still catches most concerning cases. Ask your doctor about the alternatives, because once you're in the colonoscopy pipeline, it can be very hard to get out. And now, we've reached the most overused, most dangerous, and most harmful checkup for seniors. And you've almost certainly had it done. Number 1, the annual full-body CT scan. Full-body CT scans are sometimes offered as part of executive health packages or as a preventive service in private clinics. They're marketed as a high-tech way to catch cancer early, but here's the shocking truth. These scans expose your entire body to a high dose of ionizing radiation. For older adults, especially over 70, the risk of these scans triggering unnecessary follow-ups, biopsies, and even major surgeries is incredibly high. And the great irony is that there is zero scientific evidence that full-body scans on people without symptoms actually save any lives. Each scan delivers between 10 to 20 millisieverts of radiation, which is equivalent to receiving about 500 chest x-rays all at once. According to a 2023 modeling study published in JAMA Internal Medicine, the rise in CT scans across the United States may now be responsible for up to 5% of all cancers. This puts them on par with alcohol as a cancer-causing factor. Let that sink in. 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. The scan is so sensitive that it can detect harmless nodules, tiny calcifications, or cysts that are simply a normal part of aging. But the moment they are seen, a red flag goes up. More scans follow. Then biopsies, then fear and panic. Let me tell you about Frank, an active 80-year-old who led a walking club for other seniors in his neighborhood. He felt great, but he decided to participate in a senior elite checkup at a private clinic. His full-body scan showed a tiny 3-millimeter lung nodule, which set off a chain reaction. He was referred to an oncologist, sent for a PET scan, and eventually underwent a needle biopsy. The result? The nodule was benign, completely harmless. But the biopsy procedure collapsed part of his lung, leading to hospitalization and a difficult 2-month recovery. All of that for something that should have been left alone. Experts now strongly advise that full-body CT scans should never be used for general screening in adults without symptoms. The American College of Radiology is clear. There is no proven benefit, and there is significant potential for harm. If you do have symptoms like unexplained weight loss, coughing up blood, or a new lump, then targeted imaging makes sense. But scanning the whole body with no specific target is like searching for treasure with a landmine detector. You might find something, but the damage you cause along the way could be far worse than what you were trying to avoid. A safer, smarter approach is to listen to your body. If you feel well, maintain your regular checkups with your primary doctor, and only agree to tests that are clearly indicated for a specific reason. Your time, your energy, and your health are far too valuable to waste on fear-driven screening that could leave you worse off than when you started. So there you have it. 5 checkups that may seem helpful but can actually cause harm, especially once you're past 70. Modern medicine is a powerful tool, but it's not perfect. Sometimes less is more. Always ask your doctor, what happens next if this test finds something? If the answer is unclear, or if the risks of the follow-up are higher than the reward, it may be time to pause and reconsider. And remember, true prevention starts with your lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or a treatment that turned out to be unnecessary? What happened? Please share your experiences and opinions with our community in the comments below. We would love to hear them. Thanks for watching.